Okay, so looking back now, I know that this has been going on longer, but in 2021, everything came to light after I had my third son, who is now 3.5. I I had problems with my C-section, and something was with the spinal that caused a lot of issues, but I didn't think anything of it. And before that, I'd had multiple failed epidurals and spinals. So I knew I had problems in that. And then once I'd had him, about a couple weeks later, I noticed it was not the same. I was so dizzy, I couldn't take care of him. I was so out of it all the time. And I just kind of assumed, all right, well, it's my third baby, it's just what it is. But eventually I went to a doctor, a primary doctor, and he, brushed it off like, oh, you're just a mom of three, this is all normal. But I was having migraines. I was just not okay. Couldn't take care of my baby. And so eventually I reached out to a neurologist because I started becoming like I couldn't see. The migraines were too much. I was just in bed all the time. I just was not getting any better. And so I finally got to a neurologist. Um, she kind of just said, you just have migraines, we'll treat that. And I was like, all right, I tried that, tried a bunch of different medications, nothing was helping, but I was getting way worse. And, I'd come back every 3 months for a checkup, and she'd be like, I don't really know. I think you just have migraines, and that's just what it is. And I was going back and forth with her and my primary. And I'll never forget, he told me, you just have a mystery woman's disease, and it's not going to kill you. And if you start thinking positive, maybe you'll get better. And I just remember walking out crying because I'm a mom of three, one is under one, and I don't know how I'm going to do this. I know I was trying to work and I was failing at work, and I left that job because I wasn't doing my job good, and I wasn't happy. And I just was getting bounced around. I saw a rheumatologist, and he was like, well, your ANA is positive, but that's probably a false positive. We don't really see anything wrong. And so I just kept getting bounced around back to my primary neurology and rheumatoid, all to be told like nothing's wrong. So then a few months go by, it's almost a year, and I'm starting to where I can't see when I'm driving. And I finally, like, nobody's listening to me. I've been to the neurologist probably 8 times at this point, and I'm like, I'm getting worse. So I go to my eye doctor, and he ended up being the only eye doctor that could see me immediately in all of like around Brevard County. So I called him. He got me in right away, and he did a scan. He did the full workup, and he said, you have papilledema, which is swelling on your optic nerves. And he was like, that could be multiple things. Either you have a brain tumor, you have bleeding in your brain, or you have something called idiopathic intracranial hypertension. So I'm panicking. There's a little bit of relief, like, okay, there is something going on in my brain. I'm not nuts. Like, there is something happening. And he was like, you need to go straight to the emergency room because we don't know what this is, but it's not good. So he wrote me a prescription to go there. I did wait a couple days because I was trying to get everything in order because it was like a Wednesday or something, and kids have school, everything's going on. I'm like, I can't just leave if this is
Right,
serious.
right.
I don't, I don't know how I'm gonna. Everything I think is like I have to plan around my life, and so I just sat there for 2 days, freaking out. And finally, Friday, I go into the ER. Well, I went into. He said go straight to the clinic part of the ER where they will do the testing. Well, they kind of fought me on it and said, we can't just have you walk in. You have to make an appointment, and it'll take a few weeks. And I'm like, he told me this is an emergency. And they called him and went back and forth for a while and got me an emergency.
Mm.
And then they did the lumbar puncture. They found that I did have a high pressure, and I know people have higher. It was a 28. And so they rushed me right over the ER. But they didn't want to at first. It was like, well, you can just walk or you can just go down. And the ER was very far from this office. It was on the other side of the hospital. And after you have a lumbar puncture, you're supposed to be flat. You're not supposed to do anything. But I was there. My partner at the time, he had dropped me off because he had to go get the kids. So he's like, call me when they're done. And then they wanted me to just like leave and go over the ER, but the head of radiology actually took me down to the ER, which was nice because I did not know how I was going to do all that. And so I'm admitted, and the first doctor was like, "Why are you here?" Just kind of like brushing it off. And I'm like, I was wheeled down here. I was told like this is an emergency. And finally, I get another doctor and a neurologist. They come in, they're ordering the disease control to come down. They're having all these tests run. I'm getting MRIs, CT scans, like they're rushing me, everything stat. They end up admitting me, and they're telling me like we're going to start you on this medication, and kind of just like easy peasy, you're just going to start this, you'll be okay. It's luckily it's not, you're not bleeding in the brain, you don't have hydrocephalus. They're like, you just have excess fluid and it might go away. So I'm like, okay. And I did feel slightly better after they did the lumbar puncture. So I'm like, maybe, they're like, most times it comes back, but sometimes it goes away.
Right, because if you've got too much pressure and then they take that off, you're gonna
Yeah.
yeah.
And I did, like, I felt like amazing. I could see again. Like, I felt great once I'm like, I'm good to go. Like, this is it. This is a fluke. I'm going to be fine. And then, a couple weeks go by and I'm getting worse than I was before. And I just downhill from there and trying to find neurologist. I went back to that neurologist and she's like, your symptoms don't align with IIH, and, we don't really know what to do with you. And, but then I would follow up with my optometrist, and he said, you still have the high pressure. He's like, it's not getting any better. And so it's just like going back and forth for now. It's been 3.5 years of seeing so many doctors, seeing so many neurologists, and being told like your symptoms don't align. And then, so finally, a flash forward to just in this July, I just couldn't take it anymore. And I decided I was going to a chiropractor because I'm like, the pain is so unbearable in my neck. Maybe I can get like stretched out, aligned, something, because the pain is just, and I know where the pain is. I can touch exactly where it is. And she's like, I want to order a spine MRI on you. So I did the cervical and I did the lumbar. I didn't do the thoracic, which I should have at the time, but I had no idea what
Yeah.
was going on. I didn't even know I had Chiari at this point. And I just knew where the pain was. And I said, it's either a lumbar puncture that went wrong or there's something going on in my neck. And she was like, we're going to order it. And if you want the thoracic, we'll do that too. And she was amazing. And so she ordered that. I went right in. They found it immediately that I had Chiari. And then there was a slew of other things going on with my lower back too. And so trying to stay on track, but I had a trip planned to go back to Ohio from Florida. And I wasn't doing well, but I was like okay enough to what I thought was drive. So I drove there. I was pulling over a lot after a couple hours. Like I couldn't see. I was in so much pain. My body was like locking up. I was just getting worse. And
Mhm.
then I thought it was like the pressure change. But when I finally got to Ohio after a couple days, I was in bed the whole time I was there. It was supposed to be a family trip, go see my mom, my sister, friends, and I was just in bed. I couldn't get up. I couldn't do anything. So I went to a hospital, and, they kind of just looked at me like, what's wrong with you? And I told them like what I had and stuff and what was going on. And this is still, I didn't even have my Chiari results yet. Like this was me going without knowing what was going on. And I was just like, I was in so much pain. I was like telling him like, if I push right here, like my vision kind of comes back. Like, and I was trying to explain. She's like, well, that's weird, and they're like, they just discharged me, and like they don't know what's wrong. So I tried to make it on the way home, which was a few days later, and I end up in Jacksonville Hospital because my whole body locked up when I was driving, and I was like shaking, and I couldn't see, and I couldn't move. And then they were a little bit better. They ordered a CT scan, but they said, we think you have a bone spur, and it might be pushing on your vein or something. And they put a neck brace on me and sent me on my way. So I had 2.5 more hours to drive. And it was like after that trip, I was just getting worse and worse. And, I've called my back to my neurologist and she said, all you can do is go to the Miami emergency room and see if they'll help you. Kind of like, I don't know what to do with you. And that's a great route and everything, but as like I said, a mom, I can't just up and leave, drive 3.5, 4 hours and not know what's going to happen. Like I need somebody to just be on my side and point me where to go. It's really hard here in Florida is to find anybody to. But so I was in the groups and I found somebody talking about Orlando, and they were like, they wanted me to see Dr. Man, I lost it. I called us to schedule with a specific doctor who did a surgery for somebody in that group, and she said he was amazing, took care of her, really explained everything. So I called for him. They told me he does not see Chiari patients. He's never done a Chiari surgery, and he does not. It's not something he does. When I specifically know a girl who did get the surgery with him, so I'm like, okay, is there anybody there then who can? I just wanted to get established and be seen by supposedly the top neuro in Florida.
Hmm.
And so they got me scheduled, but I started getting worse because it was 2 months out. So I I had to call. I had collapsed in the road leaving work one day, and then I called 911. I'm like, I couldn't even talk. I was just like almost like I was laying on the ground, like flagging people down, like I need help. And so when that happened, I knew it was getting really bad. And sorry, I'm like all over the place trying to. But once I finally got home, well, they had taken me to the hospital. Then they discharged me, and they're like, "We don't know what to tell you. We saw your chart. Don't know what to do with you. You want migraine meds? That's all we're gonna do." So I go home. I know I have that Orlando appointment coming up, and then a couple days later, I collapsed on my floor. I can't get up, can't move. My heart's racing, and I call 911, and they're like, "We can take you to Holmes Hospital," which has been not great here. And I'm like, "No, um, I'll just wait." My friend, she rushed me down to Orlando. This whole hour drive, I'm like, couldn't breathe, couldn't
Hmm.
see, couldn't move. I was just like, this might be the moment I die. Like I was terrified. And so she gets me in, she rushes me in a wheelchair, and I'm like laying there. And they're like, "Sit straight, sit up, like stop breathing like that." They're like yelling at me in the triage, and I'm like, if I could, if I would, like I am not okay. So they admit me for 5 days, and that was where I was supposed to see the surgeon, anyways. Like I had an appointment 6 days later, anyways. But they admitted me for 5 days, trying to just push migraine meds on me. At first, it seemed like they were going to really do tests and they were really going to figure it out. And because I was on the neuro wing, but then a few days in, they stopped all the tests. Like I still need to have a nuclear meds sonogram and an EEG done, but they canceled those two tests. They did another lumbar puncture, and that was normal. And then they just kept trying to sedate me the whole time I was there. And I'm like, I'm telling you, I'm not having a headache. Like something else is going on. Like I'm the pressure in my head, the ears ringing, like it's so intense that I couldn't even walk. I was using a walker. They had physical therapy trying to help me, and I just kept collapsing. But they kind of acted like it was anxiety. They were like, you need a psych evaluation now. And they stopped all the rest of the testing, ordered psych on me, and weren't going to help me anymore. So that's kind of where I'm at right now is like I had a follow up that they discharged me so I could make that appointment. And I drove all the way home, which is an hour and a half. And then I had to come back that next morning to their actual office to see the surgeon. And I did all the pre check in the night before they sent it to me. I filled it all out. And then I get there in the morning and they're like, "Well, we canceled your appointment. We're not going to help you. There's nothing we can do for you." And I just remember just like losing it. Like I was, the charge nurse did everything to get me discharged to make this appointment. He's like, "Clearly nobody here is going to help you. but you need to go to that appointment and still see the surgeon. So, you know, when they did that, and then they had the supervisor come out, and she was like pretty much trying to get me to be quiet and leave. And I'm like, but I can't even like walk. Like I'm sitting here like with a walker, shaking really bad. Like it was so mind blowing that they just were gonna let Nick. No surgeon would even talk to me, wouldn't even explain why they weren't gonna help me. They're just like, we're not helping you. So I'm like, I'm just gonna die. Like at this point, I'm just gonna die because nobody cares. I mean, I was having seizures, they think now, just all kinds of stuff, and they're just gonna let me walk out and not even explain why. Like, if you're not gonna help me, at least tell me
Well,
why or what I can do. But
yeah, because usually, like, I feel like the people that have this, and when they go in, even if they can't be helped, if they can explain why they can't help you, they're very understanding. And
yeah,
it's almost like because of the lack of knowledge that's out there, like, unless you find somebody that actually knows what's going on, they don't want anything to do with it.
yeah, and
So,
just say that. Like, just I don't know. It's just it makes me feel crazy because
mhm,
you know when I got my first MRI, I was at a 3 millimeter. And then when they did an MRI, I was at a 4.2. And I know that can vary between who does it and stuff. But I'm like, I'm clearly getting worse, symptom wise and herniation wise. Like, I'm clearly getting worse. And there's not a single person out here in Florida that would do anything. Like, I
mhm,
mean, I've seen tons of neurologists and none of them want to help. In the ER, going to the ER is a joke. They're like, your vitals are fine. But I have this like sensation where I'm like choking constantly and I can't breathe and I'm waking up in the middle of the night hyperventilating and just the pain and everything and nobody wants to be like this. They kind of like treat you like you're having a good time. Like I don't want to be $30,000 in debt, not being able to get out of bed and lost both of my jobs. Like this is not a fun life for me, so I don't. But they look at your age and they look at and they look, you know, you look fine. You look great and you're like if
yeah,
you had
especially when you go and see the doctors on a good day.
yeah,
Like you look fine. Then you're trying to explain, well, this is one of the better days that I've had in the last 2, 3, 4 months. So
yeah.
it's kind of a vicious cycle because I don't think nobody wants that medical debt. And
No.
I know there are a few countries out there where, their medical is paid for by the taxes and whatever. And then there are the countries like the United States where it's extremely expensive and it's one, difficult to find good insurance.
Yeah.
And like doctors that will take the insurance that you can afford. And it's just this, you know, nobody wants to go spend 16, 17, 18 hours in the ER just to have a $40,000 bill after
Mm.
one visit. So, um, so would you, if you were to list your symptoms, I know you've mentioned a few like being dizzy, the migraines, having vision problems, some fatigue, the choking, hyperventilating, not being able to breathe, um, when like in the middle of the night and stuff. I know they like to do sleep studies because that is one of the Chiari symptoms.
Yeah.
Um, would you say there are any other symptoms that you've had?
Yeah. I have this numbness in my legs and my arms. Sometimes my legs will just give out or my upper body, like I'll lay in bed and I just can't even like lift my body up. It'll just be like
So
almost
like,
like paralyzed.
yeah.
It's a weird sensation. Like I will try to lift up and I just have no strength. Um, I think I talked about the ear ringing. That's been going on for 3.5 years where it's a nonstop. And how I describe it is it's like I left a concert and I have that constant, just loud ringing in my ears and it never goes away. Um, Heart palpitations and I mean it's so much. It's just the dizziness is crazy and then the pain in my all the way through the back of my head, down my spine, and the spine is like a burning sensation.
Like
It
a
just
almost like a burning slash like numbness that goes.
yeah.
Yeah. And it is a very strange feeling too, because it's something so far everybody that I've talked to, they all have that as well. And I don't believe that that would be considered a classic Chiari symptom, but
Right.
that being said, everybody that I've spoken to so far has that. And it's like this weird tingling, burning. It's almost like at the core of your spinal cord.
Yes.
Yeah.
It's the craziest feeling. And yeah, yeah, I've explained that and they're like, well, that's not a symptom. And you're like, well, okay, I don't.
I we've talked about this before. I think they need to reevaluate the symptoms because um, they have this set list of, oh, this is the classic. But the problem is it's like when people go in and they see their surgeon or the neurologist and stuff, they talk about the things that they can't ignore, the things that are like forefront, you know? So if somebody, the majority of people are going in there, it's like, yeah, the first thing I noticed were these headaches and stuff, they zone in on that, right?
Yeah.
So we need to look
And
at.
typically, I'm not having like headaches. Like I've had headaches. I'm having like skull crushing pressure feeling. And
Mhm.
I've tried to explain that. They're like, well, that's a migraine. I'm like, but you're giving me all these migraine cocktails, all this stuff. It's not helping.
Right. So the way that that was the first surgeon that I saw, the way she had explained it was when migraine medication doesn't work, it's not something that can be fixed with medication, it's surgical.
Yeah.
So, and when it's, you know, with having that IIH, I don't know how much of that is Chiari and how much of it wouldn't be and would go
Hmm.
IIH. But at the same time, I think Chiari's well, everybody knows that it's very complex, right? And I
Hmm.
think the problem is less of the tonsils, like pressure being on the tonsils, and more of the blockage of flow.
Hmm.
That seems to be the common theme from the
Yep.
people that I talk to. And I think what it is either there's too much pressure, not enough pressure, or your brain isn't absorbing the CSF like it should. And then
Hmm.
when that happens, you get the built up pressure inside. And that would kind of explain why the lumbar puncture helped, things like that.
Hmm.
How about the cognitive side of the symptoms?
Yeah, that's bad. And it's now I think back, I was diagnosed with ADHD when I was like 7, and I've always had trouble, with my focus and stuff. But over the last few years, it's almost like debilitating. Like I will forget my kids' names. I will forget something I'm saying. Like, I mean,
So it's more
everything.
like dementia.
It feels like, and I don't know what that is, but or what it feels like to have that. But it's like I'm not there anymore. It's not me, and I'm trying so hard to reach for like memories and thoughts and what getting things out, and I'm gone. Like I just it's not there.
Yeah,
And
I
it's
would because I've had doctors try to tell me that the way that I explain it to them, they're like, "Oh, it's just brain fog." Brain fog's completely different. Brain fog is like it's still there. It's just like it takes a little bit longer to get there, and
yeah,
you gotta think about it. But the dementia part is like it's gone, and you're like, I don't even know my own name.
yeah.
So
And I've had people go, "What's your date of birth?" And I'm uh,
I
like
don't
I
know.
will actually not like a blank out, and it's really scary because I feel like I'm losing myself completely.
Aside from like the almost, I'm gonna just call it dementia part because it that's also seems to be a common theme. Can you differentiate between the brain fog and the dementia-like symptoms?
Yeah, I mean, there are days when when I'm having good days, and it's just like a normal like brain fog kind of moments. But the days where I'm really struggling, it's like I don't even know what's going on. I'm completely out of it. It's so hard to explain, but it's just I'm not who I was, and I do see a difference between the extreme side of it and the little bit where it's like, oh, I'm just kind of having a little off day, to where it's like, I cannot do a normal job. I can't, my brain's just not there. And then you
Right.
look like, when you're trying to talk to somebody and you're like, you can't even have a conversation. I mean, it would be embarrassing. My boss would be talking to me. I'm like, and I'm not like a dumb person. So it's just trying to explain that to somebody like, yeah, I'm just not there right now. It's
Yeah,
scary.
I get that. Believe me, I get that. And it's weird too because people, when you're younger and you have problems like that, they think you're either like dumb or ditzy or we're on drugs or something.
Yeah.
So it kind of has this like social stigma to it.
hmm And it's
So,
there. I just can't articulate the things that I'm trying to think. And
right. There's those days where it's definitely not there, and then the days where it's like almost like your mouth doesn't want to form the words.
yeah,
I'm guessing that's probably the easiest way to explain it.
yeah,
Which is actually when you do research on dementia, a lot of dementia patients describe it like that as well. Like their mouth
really.
will not form the words. So out of all the symptoms that you had, which ones were the most concerning?
So when my vision started going and the dizziness was so bad, I was not able to drive.
Mm,
And the pain in my neck, those were the top three that I was like, okay, something like my vision scared me the most because there was one point where everything went black. Like
mm,
it was closing in and it was black. And, that was where I was like, this is more than a headache or a migraine. Like I'm not able to see. And I have great vision. Like my optometrist was like, you have like near 20/20, like perfect vision. It's just, it's clouded and it's like everything closes in and I have black streaks and I have all these
mm.
like issues over my eyes now.
That's interesting because I was told last month I was told by an optometrist that if you have papilledema, it's difficult for you to get close to 20/20 vision. So,
Really.
yeah. I don't know how much of that is true, but that's what she did tell me because she was shocked that they were able to adjust my glasses and whatnot to get to that point. Um,
And I've always had great vision. So this is like such a new thing over the last few years where I'm like, it's hard to explain because I can see, but then everything's cloudy or foggy or blurry and it's like things
comes,
aren't lining up. Yeah.
yeah.
So, but when I'm not having a severe episode or when I feel a little bit better, my vision's okay. But those moments where I'm like, I can tell it's like a high pressure or something's happening, everything's blurred out and I can't see. So it's almost like a lens that gets put over my eyes. Like I have good vision and then I have like if somebody put glasses on me and now I can't see.
Hmm.
Is the best way I can explain it because he did a check on me a couple of months ago and he was like, your papilledema is gone, but I'm still having the really bad blurriness. So I don't know if it's done permanent damage. I mean, he said right now it looks good and he's amazing. Like I've seen other neuro ophthalmologists that told me there's nothing wrong with you. He was the
Right.
one that, and so I trust him more than anybody else. And he was like, your eyes are back to normal. He's like, I would never have even guessed you had papilledema now. So that's great, which my vision has gotten better. But in the beginning, it was so deteriorated, I could not drive.
I will say the body is a very interesting thing because especially with the brain, there have been times where like somebody's missing half of their brain and it rewires itself to function.
Yeah.
So I think after a time, the body will kind of start to self-correct it. Um, and while you still have things going on, like it'll kind of start to alleviate certain things, or you know, granted, that's just a theory of mine. I can't
Yeah.
really, but
Well, I
it
mean,
it makes sense to me
yeah.
that it would try to at least do that. Um, especially the brain. The brain seems to be smart enough for self-preservation. So whatever it can do to, alleviate its own problems. Would you say that the vision, the dizziness, and then the pain is what caused you to go, oh, I need to go to the doctor. Like this is why I'm going to the doctor.
Yes. But you know what? And one thing I did miss was when I this all first started, I thought I just had allergies because I was leaking out of my nose. My ears would be soaked. My eyes would water all the time. So while I was doing this whole migraine investigation and stuff, they sent me to a um, allergist and ENT, and that's where it kind of started to where I'm like, something's going on, and I was doing injections and everything. So I'm like, well, maybe this is what's causing it. Like, you know, maybe there's just something going on with allergies or something. And then, they did the tests on me. So I'm doing injections. I'm doing all this stuff and I'm still having like dripping out of my face.
Was
That
it
was,
was it like the consistency of like water?
it was just water coming out of me everywhere all the time. And that's when they found the high pressure. It was right around that time. But I mean, I had septum surgery because I'm like, well, maybe that's what it is. They found a cyst in my face and everything. And I'm like, maybe that will fix it. He was like, I don't have high hopes for that. I don't think that's what's causing all your problems. But I started with that route. I'm like, there was a cyst right under my eye, and then I had a deviated septum. So I'm like, maybe that's causing problems. Like, I had the can't think of the name, like I had sinus infections nonstop. So I'm like, well, maybe that is what's causing, all the buildup and stuff. They did the surgery, nothing got better. And he was very honest. He's like, I don't think it's gonna fix everything, but we can try. And because I was not breathing right and stuff. So um the dripping is still going on. I will wake up and my ears will just be soaked. And I've had doctors tell me that has nothing to do with your condition and that wouldn't be happening. But it's
I
happening.
I used to get the like my nose would just randomly start running.
Yeah.
Like it wouldn't be like I was stuffy or anything. It would just be like
Yeah.
water coming out. And that stopped after my pseudomeningeal showed up.
Really.
So my guess is, and there's been multiple people that have told me that they're like, well, the doctor says that I can't have stuff leaking out of my ears like that, and it's not CSF, or, you know, I think I think that that's also something they need to look into. That it's almost like causing micro CSF leaks or
Yeah.
something. I know that it can be difficult to find those leaks, especially if they're like pinhole leaks.
Right.
That's something I feel like they need to do more research on.
And when he did that septum surgery, he said there is a chance you will have a leak. And I'm like, oh my gosh. Like, because this is before everything, like before the Chiari IH, like this, he was like, there's a chance of a CSF leak when I do this. There's always a chance of that. And back then I didn't care. I didn't know. I was like, well, okay, that's kind of scary. He's like, you can go blind. All these problems can happen. And not saying like it was because of that, but like thinking back, I've had all these risks to a CSF leak. I've had like 12 epidurals, like 9 spinal taps. I've had enough to where there could be a leak, and I have the symptoms of it. Like, I mean, that's why they sent me over to ENT because I was just having like just water constantly out of my nose, out of my eyes. And then I'd wake up, my ears were just, like I said, like soaked and stuff. And then they would check my ears and he's like, well, I do see fluid in there, but you're not sick. I don't see anything else wrong with you. But he kept saying he saw fluid in my ears. But I've had other doctors tell me, like, that's impossible. But it's happening. It's actually happening. And it's not like a runny nose. Like, it's not like where I need to blow my nose. It's just a random drips. And
Well, if you think about it, right? the I don't know if membrane is the right thing to call it. The tissue inside of your head, right? Um, it's kind of like porous, when you get into your sinuses and stuff. Um, because that's the same way like mucus and saliva and stuff. Because like I know people that will literally like it's kind of gross, but like suck spit up and then snot it out. Um, and I think I don't know. I like to call it like a almost like a thick sponge or something, kind of like
mhm.
and see, you can feel that inside of like the roof of your mouth and stuff.
Yeah.
Almost like maybe it's just seeping out, pooling, and then draining. I mean,
I
if
mean,
you've got
yeah.
high pressure, it's got to go somewhere, right?
And I did have one doctor. He was in the Orlando when I was in the emergency department. He did tell me, he's like, Chiari's no joke. He's like, your symptoms are real. And he said, it absolutely will start escaping. He's like, where's it going to go? He's like, it's got to go somewhere and it can start escaping. Because that's the scary part too, is thinking, what if it gets so full? Like, what's going to happen? And that's what I wait for every day. Like, what's going to
That's where
happen?
I'm at. That's where I'm at with that pseudomeningocele. I mean, I didn't have it, and you could see it in my MRIs where it's like there was enough pressure that it stretched out the dura patch and then
Ugh,
a pop. So I mean, it'll build up until it finds a way out because, like I say, your body is going to relieve that somehow
yeah.
because self-preservation, whether it's an accidental thing or not, um, it's going to happen.
And what's
Because
crazy is on my CT scans, they'll be like, oh, we don't see excessive fluid. But I was in the, like, I could feel, like, I'd move my head and I would feel it. And it felt like my lungs were filling up. Like, I could feel fluid everywhere and I wasn't sick. And they're like, well, your CT scans are fine. Like, everything's fine. And I'm like, but I can actually feel it. So I don't know if it's like trapped or it's just moving slow or if I go high pressure, low pressure. I have no
there's,
idea.
there's also like normal pressure hydrocephalus too. That's a thing.
Oh, and see, I didn't even know that.
Yeah. So it's I've the more that I'm talking to people and the more research that I'm doing, I'm finding out just how complex that it is. Um, More so than I thought or anybody I know has thought. Um, I'm sure the surgeons understand it. That's
Yeah.
what they do. Uh, let's see. I know you haven't been decompressed. Um, has any surgeon even considered decompression for you?
Nope.
Have any of them even brought it up, mentioned it at all?
They said I'm not a candidate,
I
but they've
know.
had other people come tell me that. Like I've never actually had a surgeon. Well, I had one surgeon come talk to me and he talked about a shunt. And then, I was kind of like, well, isn't that going around the problem? Like if the problem is my blockage, why would we just reroute it?
So that I've been told by surgeons that Chiari when so there's the two different kinds, right? You've got the congenital where you're born with the malformation,
Yeah.
uh, and then you've got the secondary. The secondary can be caused by multiple things, head trauma. I've heard of people going into labor and having a really tough labor, and like because of the force of pushing, it causes it. I have heard of CSF leaks causing it because, like, especially in your if you have a LP,
Yeah.
um, if it doesn't heal properly, it's got that like vacuum pulling it down, and then
Mm-hmm.
so like hydrocephalus can cause it as well. So if he's talking about a shunt, that would tell me that he's thinking that you have probably a secondary Chiari, which would make sense. It like
Yeah.
um so the surgeon that I've been seeing at Johns Hopkins, he had said that if you get surgery, you get a little bit better, and then it comes back. That's a telltale sign that it was the Chiari was not the main problem. So
Right.
if they go in and they do a decompression on you and it's not the main problem, you're going to go back to where you were or just as, start progressing and get worse. So
Right.
it's kind of that game of trying to find out what came first, the
Yeah.
Chiari or something else. So
And my neighbor had that. She had the Chiari surgery first, which is crazy. I met my neighbor through all this who has that. And they did the decompression, didn't help. And then now she has a shunt. She's had two shunts put in because her stuff was just so bad. It just kept getting worse. And she's kind of better, but even then, she's still not great. So it's scary to see somebody every day who's done everything. and still not.
I I completely understand that because that's where I'm at.
Yeah.
Let's see. So I know we had touched a little bit on your comorbidities. Uh,
Mhm.
aside from the IIH, I know you had mentioned in your spine and whatnot, things like what is that? The myelopathy, um, degenerative disc disease, um, spinal stenosis. Those are all considered comorbidities. So,
So they found a bulging in my ventral thecal sac. No one's ever explained really what that, is, but
you
and they
said,
found, disc degeneration and um mild left neural foraminal narrowing or something. Foraminal narrowing. So there's like they wrote all this stuff in here, but I no one's ever been like, that's what this is. Like this could be, but something is pushing into the base of my spine. And they said somebody did tell me that that's very dangerous.
yeah.
And I'm wondering if that's causing, because I do have so much pain in my legs and numbness and stuff. And I'm wondering if that's where a block could be too. But nobody is like, looked at my MRI and went, okay, this is what's going on. This was from an imaging center that wrote all this up. But then when I went and had the second set of imaging, they're like, well, no, we don't see any of that. So how could two within a month be so different?
So that I'm finding that that is a issue with the radiologists because we're getting I don't a lot of it is based on personal experience and their education level. So
Mm-hmm.
if you get a radiologist that isn't completely educated on what they need to be educated on, you're going to get those discrepancies.
Yeah.
Um, that's the same as with my pseudomeningocele. I think I told you before about this. I have had three different MRIs. Each one said different things. So I have one that he said that there's absolutely no sign of it. I have one where they said, we're not too sure exactly what it is, but we think it kind of could be. And then I have the one that was reviewed by the surgeon at Johns Hopkins, and he said that's exactly what it is. So if they don't necessarily know what they're looking at and they don't see it enough, you're
Yeah.
going to those difference of opinion. And I think well, because we've talked about, there needs to be more research and education. I think that needs to be more across the board, not
Absolutely.
just with Chiari. Um, this goes for medical in general. So, you know, radiologists, the primary cares, the neurologists, like, yes, they do a lot of research on a lot of things and they have a lot of education, but they may be missing, they may have gaps. So
And it's not like the TV shows where they'll reach out to somebody else who they're like, oh, well, we don't know. So let's call somebody who does know. It's they're like, we don't know.
that's why I like Johns Hopkins is because one of their biggest things is they're like, we don't know. We have colleagues that do, so we're going to ask them.
Yeah. And that's what
Have
they should
to,
all be doing.
yeah. And it seems like the places with the higher, I don't know what you would call that, maybe prestige, maybe.
Mm.
Um, the places that actually have a name that they can't like tarnish that name, they do that. So like the Mayo Clinic, you've got
Yeah.
Johns Hopkins, and those kinds of places is where they're going to do that. The local level of like hospitals, they're like, we'll just pass you on, and then you're stuck in this cycle of, well, primary care says it's neurological, neurology says it is surgical, surgical says primary care, and you're just stuck in this loop. So
And you're just going back and forth to these appointments. And they're like, well, go back to your primary, go back to your neurologist, go back to this. And you're like, I can't keep doing this. And then by then it's a year later and you still don't know what's going on.
give you a bunch of medications. They tell you, oh, you might just be depressed. So they put you on antidepressants and, nothing ever really gets fixed.
and they push this whole anxiety. I've had anxiety and depression my whole life. But I know the difference between what's going on with me, and yes, it is causing me to have more anxiety and depression, but that's not my cause. That's This is my cause, and
Hmm.
this is making it spiral. Like I notice when I get stressed out, it makes it so much worse. And I mean, I can't, and it's hard not to be so stressed out when you're just begging people to listen to you
Hmm.
and they're like, nothing's wrong with you. So then you do spiral and you do look crazy and you do, like, I mean, you get it.
Yeah, yeah,
You just
unfortunately.
start spiraling.
Yep. And then let's see.
And I come in every time with a binder, like of all my stuff. And I think they think I'm looking for problems. And it's like, no, I just document everything that's going on with me. I have like all my papers laid out of things and what medications they've tried, what didn't work,
I
just the
went in um I went in with a binder of all of my notes. Everything down from the first ER visit when they found my Chiari and they told me that it was complex migraines and not Chiari.
yeah,
I went in with that. I took all of my MRIs and I had them numbered in order from the first one to the last one. Like going in prepared, when you go in and see somebody that's like actually a specialist, you are treated completely different.
I
Completely
know.
different. Um, because I've done that with my neurologist and like primary care and stuff, and I've had that where they're looking at me like, you are going a little overboard. And then you go and see a
Yeah,
specialist. They're like, oh, any kind of information, bring me all the information,
right.
right? So I think there needs to be more education at the local level. And I understand that the research centers are putting out the guidelines and they're trying to get that out there. But I mean, unless it's a well known thing, a well known illness, we're not going to see that at the local level for a very long time. Um, which is, I hope this project, part of it, is going to help with that. You know,
Mhm.
if we're loud enough, like they're going to pay attention. So
I mean,
that's
how many places I've been where they're like, I don't even know what Chiari is, or Chiari. They're like, what's Chiari? Like, no,
that's my
nobody
favorite.
knows what it is. And I didn't know.
The
I mean,
moment
I
I yeah, yeah, I love when they pull out that Chiari and you're just like, what? That's the moment that you know, like, and they'll fake their way through it, and you're like, nah,
oh
you don't
yeah,
know how to say it, so I'm not going to trust you. Um, which is,
I had a nurse. I'm not gonna lie, I had to go out and Google what that was. But she was amazing. Like she's like, but I had to go Google what that was.
I would much rather them tell me that they had to go and Google it to learn about it, because at least that shows that they're expanding their knowledge on it, whether
Yeah,
it's just to figure out how to say it or what. Like, that's more than just them pretending that, oh, yeah, I know everything there is to know about it and you're fine, and
yeah.
I, it
And you
definitely.
hope like maybe she went home and she's like, I'm really gonna learn about this. Like I always hope that they're like they
Hmm.
learn something that day and they next time if they see it, they're like, oh, I'm a little more prepared to help this person.
Yeah. Yeah. Because while people that have it and the people that are symptomatic are told that it's rare, it's actually fairly common. I think it's like 1 in 1,000 people have it.
Oh, yeah.
The majority is actually just asymptomatic. So they don't necessarily know how many people have it, because the only people that they are seeing are the ones that have the symptoms, unless it's
Yeah.
an incidental finding where it's, they go in for something else and just happen to see it. So I think that definitely, I don't want to say that they should scan everybody for it, because that's a waste of taxpayer money and our own resources and whatnot. But
Yeah.
I wish there was more looking into it. Uh,
Well, I'm in that IIH group and all of them, like I try to tell all of them, please go get Chiari ruled out because they all have the same symptoms. They're not getting any answers. And that was me. And I was in those groups. And then finally, I find this. and it's like a little bit more of an answer because they're all complaining of the neck pain, the dizziness, the seizures. And I'm like, please go get a spinal MRI started. Like, start looking
Yeah.
into this. Because I
I think,
think most of them have it.
yeah. And I really feel like the patients need to go in with their own education as well, so that they can sit in there, talk to the doctors, understand what the doctors are saying, because I gotta admit, a good portion of them will use the medical terminology just to confuse us.
Hmm.
I always say that if you truly understand a problem, you'll be able to simplify it for even a child.
Yeah.
So if you can do that and you can explain it to a little kid, you can explain it to an adult. And if I've had some where I asked them, like, they would give me, a really long word that I can't pronounce and they can barely pronounce. And I ask them, well, what is that? And they're like, well, that is what it is. And then they can't explain it. Right.
Right.
So if patients are able to go in, um, because of resources that, like, they've done the education, they've done reading, they've researched on their own, um, we should be able to ask the doctors, hey, what's your differential diagnosis? Any
Yes, I've heard that's a big one.
if all doctors, when they're in med school, I think it's like the first year they learn how to do a differential diagnosis. And that is extremely, extremely important. If they can
Hmm.
find something that matches it and then start ruling it out, eventually you're going to find what the cause is.
Right.
And root cause analysis is one of the most important things in research, because if you can narrow it down to what's causing it, you can fix the problem.
Exactly. And to the point of like when you were talking about how, they just throw these words out. Well, this lady didn't know that I knew what Chiari was because I walked in and she's like, you don't have Chiari. She's like, you have low-lying cerebellum tonsil ectopia. I'm like, that's literally Chiari.
Mm-hmm.
Like, I think she thought she was going to pull one on me. Like, this girl's an idiot. She doesn't know what she has. And it's literally the same thing. And
I
she
think,
tried to use those big words.
yeah, I think the difference is um, I hear that when they don't necessarily know what they're talking about. So when they don't know how to explain it, they try to be like, well, it's completely different. Um,
Hmm.
I'm finding that it's pretty much interchangeable between the two, with maybe some slight differences. Um,
Hmm.
so I know you mentioned you have kids.
Yeah.
Uh, have you had any of them screened?
So I am in the process right now of they all had their eyes tested.
Mm-hmm.
Um, it's weird as my middle child, before I even knew any of this, he's 7 now. So when he was 6 months to a year, he was having these episodes where he would cry and scream and he would go out of it. Like he'd go limp and it'd be positional. It would be weird things happening with him. We took him to a neurologist and they did an EEG and said, we don't know what it is, but he's fine. He still has headaches. I took him back to my optometrist. They're like, we don't see any swelling on his optic nerves or anything. I'm very, very adamant about that's the starting point because that's what I found everything. But he will be seeing a neurologist because he always has headaches and he's just, and then my youngest one, he's only 3 and he will be sitting in the car seat and he'll grab his head and he'll start crying. And, their dad doesn't really, because he doesn't live with it. He doesn't think anything. And I'm like, I'm watching. And I'm not trying to be like Munchausen by proxy kind of thing, but I'm very like, what's going on? Like I'm not so obsessed with it that I think something's happening with all them, but I just watch the signs. And he did fail his eye exam for like they saw something, but so he'll be going to a pediatric eye doctor. But he does worry me. He's very tired all the time. He's 3. Like he'll go, but he has to take
You
breaks
should
and lay
have
down.
all the energy right now. You should have all the
I
energy.
know, and he does, but like none of my other kids needed to take a break as much as him. And he just, when he cries about his head, it worries me because when I sit in the car, that's when my symptoms are the worst. And that's when his seems when he starts to cry. And then my oldest is actually being tested for Ehlers-Danlos syndrome because his doctor thinks he's textbook. Like he can stretch his skin out, he can move his body in crazy positions. He's having chest pains, heart problems.
It's interesting how all these illnesses connect to each other.
Yeah,
Is because that's another thing that can cause Chiari is having Ehlers-Danlos, and there's like I think there's like 15 different kinds of Ehlers-Danlos. Like there's a lot. Um, some of them are easier to see than others, and it's the same with like hydrocephalus and the IIH and stuff. Um, it can be kind of difficult for them to diagnose.
yeah.
And one of the things that was brought up in the last interview was um, the research. There's more research done with pediatrics, and
I love it.
I think what that is because parents, as adults, like we push through because we have responsibilities. We have to go to work. We got to keep the house in order. We got to make sure the kids are fed. We got to make sure they get to school. We got to make sure everything's done and in order. So we put our issues aside to make sure things keep going.
Yeah,
And when you have children, that changes and your priority are the children. So you're
yeah,
watching, if they're doing something weird, you're like, that's not quite right. So parents are more likely to take their children into the doctor to get diagnosed versus themselves. So,
right.
which I feel like that's kind of like a double-edged sword. It's good because, you're making sure your kids are okay, but it's also unfortunate because you're putting your own issues aside for them. Um, Granted, that's, you know,
They're,
comes with
they're
being a
getting the best. Their doctor actually cares, and she's
Mhm.
like not playing around. She's like, no, we're going here, they're going there. And the sad thing is, I might get answers for myself because of it, and I don't want that. I don't want because my kids now have to suffer this because of me because I had no idea. But now she's like, well, EDS is hereditary. She's
Yeah.
like, and you have Chiari. She's like, so there's a good chance you have. And I'm like, but I'm not. I have no symptoms. I'm not flexible. I don't have the same things. But she's like, but there's so many that fall under that, you know,
His EDS
MCAS is what.
umbrella, yeah. It's the connective tissue disorders. So there's a lot that falls under it. Some of them, like I know people that it's very, very mild. And then I have a friend that like from the time I was like little, like his mom and my mom are best friends. He's got it and he has very severe EDS. So it
Yeah,
completely range, even if you have the same kind, like you could barely show any symptoms, whereas somebody else with the same exact type is going to be extremely symptomatic and have issues. And it's the
hmm,
same with the Chiari, right?
yeah,
Um, you can have it to where somebody has like 12 millimeter herniated and they're they're fine, you know.
yeah,
Whereas you can have somebody without a herniation and they're completely symptomatic. And then that's where like the Chiari zero and whatnot comes into play. Um, they're finding with the research that herniation doesn't particularly make a difference. I
yeah,
know there's that strict 3 millimeter to 5 millimeter, or else you don't have it. And even then,
hmm.
there's doctors that say if it's less than 5 millimeters, then you don't have it. And
And
it's
that's where I'm at.
yeah, yeah. We talked about that about you know they're saying that it's not herniated enough, but really they're finding you can have absolutely no herniation and still have the
Yeah,
symptom. So I think that Chiari, if you have a secondary, is a symptom and not a diagnosis.
yeah,
Because the more digging it's like this giant rabbit hole, right? The more digging you do, the more you're realizing like that's not quite right. Well, yes, it
yeah,
looks like it. It's that instant on the MRI, that's what pops out. So it's easier to just be like, this is what it is, instead of digging to find the cause of it. Um,
Yeah.
every problem in life, whether it's inside your body, at work, at school, just in day to day life, every problem has a cause. So they have to sit there and do their differential diagnosis to figure out, is this, does it have a different cause? Am I looking at it the right way? Um, I don't think they're necessarily looking in the right places. Like they're looking, just I feel like they're missing parts of it. Um,
Yeah.
let's see. All right, we're getting towards the end of the list of questions. Um, so I know you had mentioned your pain. Let's talk about that. The kind of pain, like where it is, things like that.
So the biggest complaint I have is like right in the base of my skull, like where it connects to my head, like my spine. It is just excruciating. Like last night I was up probably 6 times and I had ice packs all over my head and I'm trying to change positions and I'm just like the pressure is so bad. Like I'm like just laying there like I just end. Like I can't take it anymore. I can't get comfortable. I'm not sleeping. I'm not it's debilitating. And I think a lot of doctors think, when you come in, you're like, oh, I'm in pain. They're like, oh, she wants pain meds. And I feel like that's what a lot of them think. And it's like, no, I just want to like not feel like my head's going to fall off of my body every day.
And
It literally is excruciating.
yeah, and I feel like doctors don't realize how the pain medication um, doesn't particularly work.
Right.
So it's like I don't take ibuprofen, Tylenol, Aleve, any of that because it doesn't work. The only
Yeah.
thing I've found that works is maybe ice sometimes or some heat.
Hmm.
Other than
Yeah.
that, like I've had like pain medication like Vicodins and things like that, and
Mhm.
they just didn't work, and I just you know stopped using them because what's the point in taking a medication if it's not going to help you?
Right. And I'm scared about my liver because I've been taking Excedrin, I
Hmm.
mean, every day for years. And it kind of, I mean, it'll take like the edge of it off, but it never takes it
Sure.
away.
Yeah, you start building that tolerance, and you have to take more and more and
Yeah.
more. And I personally never liked medications, so
Hmm.
when it comes to like the harder stuff, you know, the
Yeah.
things that are difficult to get through the doctors, but they believe that you need it because you do have things going on. I mean, if you start taking that and you're like, well, it's not working, so you take another one, that's where the addictions and stuff come in. And I
Yeah.
think there's a stigma around that as well that causes, if you run out of medication earlier because it's not working, then they're thinking, well, now you're just pill popping.
Yeah.
So, um,
They did fine. So I was in the hospital one time and she's like, we're going to give you Valium. And I'm like, I'm not anxious. Why are you? I didn't know really what it was, but I knew it was for anxiety. And I'm like, why are you giving me Valium? I'm not having an anxiety attack. She's like, no, it helps with seizure-like symptoms and it helps with dizziness. And I'm like, all right, because I always reject medications. And I'm like, all right, like I was desperate. I'm like, I can't see anymore. Like that's fine. And that is the only medication that I've been on that does control a lot of my symptoms. And that's why they think I'm having seizures because it is used to treat seizures. And so I will take like a half or a quarter of it. And I finally, I hired my friend as a doctor and because she believes me and because the hospital gives you that and then they send you home and you're like, oh my God, that's helping. But then you go back to a doctor and they're like, well, that's a narcotic or that's a controlled
yeah, why are
drug. And
you
we're like,
that?
I didn't put myself on this. I had no clue what this was, but it did work. And none of your other medications are working. But for some reason, that shuts down that part of my brain that's like going too hard. And I'm able to move my body and stuff. It's the only medication that's helped. And it
Hmm.
does have a risk of addiction, but I can tell you that I don't feel any different on it. And my one friend was like, Crystal, you should be comatose right now. She's like, you took like the dose of like somebody could not drive. And it was the only time I felt better. Like my normal state of mind is comatose, feeling like crap. And then I take it and I feel like a normal person.
I
And it's
know,
weird.
yeah. I'm wondering what it, because I don't know too much about Valium. Um, I know it's for like people use it to calm down and stuff. Um,
Hmm.
I seizures and whatnot can be caused by like pressure on the brain.
Yeah.
So that brings me back to the whole. I wonder if it's a flow problem and not a like you know the sandwiching of your tonsils and whatnot.
I
Um,
1000% think it's flow.
yeah, and we've talked about this a couple times. I really think that uh, they need to look at unless they see it in you from like the time you're a child, because there are some where
Hmm.
like the babies are they go in for whatever imaging as babies and then they find out that they have it at a very young
Yeah.
age. um I think that they need to start looking at Chiari less of a diagnosis and more of a symptom, because the more people you talk to about it, a good chunk of them have a some sort of CSF issue. So
Hmm.
it's being caused by something else and it's a symptom and not a diagnosis. They'll have a much easier time treating it.
Right.
And I think that's like we've talked about before. They need to do more research. Um, let's see. Here we go. We'd kind of started getting into the social aspect of it in day-to-day life. Okay. Outside of the medical part, um, how are you treated in the day-to-day life?
Like as far as like people,
Yeah, so family, friends, at the time that you were working, coworkers, things like that. Um,
I think in the beginning, a lot of people, especially family, thought I was exaggerating or, I remember somebody in my family telling one of my kids, "Oh, she's fine. It's not that bad and stuff." And I think there's a lot of disbelief or not understanding that it is debilitating.
mhm.
I lately I've had people, be empathetic and stuff with me, but I truly don't think people understand how how much of my life is affected. And you know, a lot of my friends they understand like I don't really go do anything with them anymore. I don't. I used to go out paddleboarding. I used to be very active and now I'm not doing anything. And I think people get it, but I don't think they necessarily
Understand it.
believe it. Yeah, I
Yeah,
really it's like, well, I think if she just did this and no one's ever said anything or but you can feel that like I don't think people truly believe it's that bad. That I'm actually laying in bed all day or when I know my boss really wants me to come back to work, but I don't think he understands like how bad off I am. And they've had to call 911 for me, and I mean they've watched me, and I went from like okay to just severe. And I think people are like, how does that even happen? And it makes you sad and feel isolated because you're not making it up,
yeah,
but you feel like everybody around feels like you're a burden or you're
yeah,
just
yeah. And that
lazy.
I think that's a very deep-seated feeling. Even if they don't feel that way, like it's hard not to feel that way because you yourself feel that.
Yeah.
And like I was I wouldn't say lucky, but I was like with my work, I've been very fortunate because
Hmm.
when I found out like they were there from the start till now, like from the very beginning. So they've all watched me like go through the decline. So
Yeah.
there's more of an understanding at my job and in my life and whatnot because the people like they actually saw it. Um,
Yeah.
Whereas I think if you don't have that where people are actually coming up to you and be like, "Hey, are you okay? You look like you're not doing too well today." Like it's harder. And
Yeah.
the way that I had described it to actually yesterday to one of my coworkers, um, when you have this, we tend to try to hide it as best we can and just push through it. And when you get to that point that you can't hide it anymore, is where people are like, oh, it's all of a sudden, like you were fine just
Yeah.
yesterday. But it's what it really is it's so bad that you can't hide it anymore. Um, and honestly, it's kind of heartbreaking because people just they don't
If they
understand.
only knew.
Yeah,
Yeah.
yeah. I know with I've got a handful of friends that and family that they've watched that decline and they know just how severe it can be. And
Yeah.
they're understanding about like if we're gonna go do plans and I'm not feeling well and stuff. And I think I've been fortunate to have that support system. Not everybody's
Yeah.
fortunate. Um, which is yeah, I wish everybody had that kind of support.
Yeah.
Uh,
I mean, I've gotten lucky, but not everybody does.
yeah. So what do your good days look like? You know, the things that you enjoy, the things you're able to do. What does that look like for you?
So anymore, all I want to be able to do is take my kids outside, be able to play with them. I do miss being I used to be so active. Like, and I would love to go hiking, not necessarily like, into big hiking or anything, but like exploring. I got into paddleboarding and, we moved to Florida to have adventures and do fun things. And ever since we got here, it's like everything went bad. So like a good day would just being able to be outside, go to the beach, go explore something. And it's
And
so depressing because yeah, I mean, I we came here to have a fun life, and I feel like I've ruined that because it's every day is beautiful, and just can't go enjoy that. So yeah, I would really like to be able to go back to exploring where we live.
enjoying life. Um, Now, on your bad days, on your worst days, what does that look like?
I'm in bed. I can't have a conversation. I ice packs, no light. There's been just times where I'm just like shaking uncontrollably. I can't see, and just showering is just it takes everything out of me just to get in the shower, or if I need to, do dishes, that's it for the day. Like, I mean, I got one thing in me and that's it, if that. And I'm just laying here like lifeless.
I know I had heard somebody talking about chronic illness, about they use the analogy of spoons, right? Everybody starts out
Yeah,
with the same amount of spoons, but what may take somebody one is going to take you like three or four, and it once you're out, you're out. Your battery's gone.
yeah.
Um, I know that can be very difficult. Um, so when you have your flare-ups, can you differentiate between a Chiari flare-up and like say your IIH?
Honestly, at this point, I don't even know. Like, I know when the pain is really bad in my neck, like I can tell, like that's Chiari going on, like in my spine, my neck, but it's hard to know anymore, what's going on because it's just so much. The symptoms are so vast that I don't even know what's happening.
And I'm sure there a lot of the symptoms will also they cross over.
Yeah,
Um, I know I can tell, like, there are some days where it's like, I know exactly where it's coming from. Then there are
Hmm.
days where it's like everything all at once. So, and I've heard that from a few different people as well. Like some days it's just one thing, other days it's the different one, and then it's all of it together and combined into like this super illness that just
Yeah.
is fun. Is not fun. Um, yeah. Let's see.
Before we do another question, can I take a bathroom break?
Yeah, let me pause
Or
this.
is that gonna?
No, you're good.
Okay, I'm sorry.
All right, and we're back. Let's see. I've already been through that. Why is it important to you to share your story?
I think the most important part is I felt so alone through this whole time, you know, and I think there's so many people out there who feel this way, where they're just like, you get to a place in your life where you're like, I don't, sadly even want to keep going. And it's hard to want to get up the next day. It's hard to want to live. It's hard, when you feel so isolated and nobody's listening to you. I think people need to know that there are so many other people out there that feel this way. And, whether you get better or you don't, knowing that there are people out there who understand you is so important because, you know, it's a very depressing feeling. And I want real neurologists and surgeons to hear these stories and start expanding their knowledge to where the typical Chiari symptoms aren't the baseline. I mean, that is baseline, but there's so much more that goes into it that I think they need to do more research. And hearing these people talk, all of our stories, I think it's going to make a huge difference in changing the way they look at us.
Yeah, I agree with that. Part of this, well, a good chunk of this, I want them to realize because, they, especially the ones doing the research, um, it when you do research, you have to switch over to an analytical mind, right? When you're in that mode, you're no longer thinking of the numbers being people. You're thinking of the numbers being a percentage and the numbers being numbers. So I think it's important to remind them that it's people that are suffering.
Yeah.
They're doing it for a reason. And that also ties into the other part of this project when I can eventually get some neurologists and surgeons and whatnot to come on board to kind of close that disconnect,
Yeah.
because patients go to the doctors because they need their help. The majority of people don't like going to doctors because of the experiences like you've had, the ring around, the nobody really wanting to help. And it's this difficult thing where the patients need to understand that there are doctors out there that are doing their hardest to make sure that they're okay and help them. And the doctors need to understand that the people going to them, like, usually by the time they go to a doctor, because especially adults are so stubborn, by the time they go to the doctor, it's their last resort.
Yeah.
That's it. Like that's all they got. They used all their finances, all their energy, all of their emotional capabilities just to see them. So I think that's very important. Um, all right. In your opinion, what is the most difficult aspect of the healthcare system, and what would be a simple fix or addition? So even if it's not a fix, just something that they could implement that would make things easier.
I think just believing your patient, it's like so basic, but it's like they look at you as you're a young woman. You shouldn't be sick. There should be nothing wrong with you. I think they just need to believe that people are not just walking in for no reason. Like, and we need to stop age. It's not an age appropriate condition. Like, it happens to babies and it happens to adults. It
So
happens
like
to every,
discrimination.
yeah. I think that's the biggest thing is when they look at, especially a woman who's in their 30s, they're like, well, you should be healthy. Like, there should be nothing wrong with you. I think that stigma needs to stop, that we are it doesn't matter your age. Your symptoms are real. And I wish that that's the one thing I wish that doctors didn't look at you and your age and go, well, you should be healthy, because I wouldn't be here if I was fine. Like you said, like we're going to the doctor. It's our last resort. So that's one thing I wish I could see different, is the stigma of women and their age, and saying it's anxiety and trying to treat other things before you really listen to what they're saying. That's my biggest thing. I think because that's what I've experienced the most is, you're a young woman, you should be healthy. There's nothing wrong with you.
Yep. I completely understand that. Like when I first went to the ER, that was the thing, was you shouldn't be here. These symptoms and what we're thinking it is, because I got triaged fairly quickly. They thought I was having a stroke.
Yeah.
Uh, they were like, you shouldn't be having this. Like, you're too young for this. So I completely understand that. Um, what would you like to say to the doctors who did not help you?
To be kind about it.
Just say how you feel, kindness or not. Like,
You know, this is not a life that I want. This is not, every day I look at my kids and I'm just so sad because they don't deserve to have a mom who can't be 100% or at least 50%. I've missed out on a lot, and I wouldn't be here like asking for help if I wasn't desperate. And it just makes me so angry that so many, like more than not, have looked at me like I'm nuts. And it makes me so mad because I'm coming to you for help. Like, this should be what you want to do. You should have got into this field to help people. And I think neurologists, for some reason, are the biggest problematic in healthcare. Like, if they don't know, their ego is so high that they're just push you off, brush you off. They don't care, and it makes me so angry. I mean, I just if they could just explain things, that would, I mean, I've had so many of them tell me, we can't help you, but nobody tells me why. Nobody, I'm just so lost. And it makes me just furious because why did you get into this profession if you don't want to help people?
right, right. That's the whole reason.
Yeah.
I'm sure there are the ones that thought, "Ooh, I can make a lot of money doing this," but at its core, healthcare is to help people.
Yeah. And to
Yep.
just hear, you just have a headache. It's just a headache. And you've explained a million times, like, it's not a headache, like, it's a million things. It's
Right.
just
And
frustrating.
usually the people with this, the headaches are something that they can ignore and move
Yeah.
past. And it's not even the most concerning issue. Usually it's the cognitive deficits or the dizziness or the balance and coordination, things like that. Um, and I think that's something that needs to also be reevaluated, because they'll say, well, if you don't have the classic Chiari headache, then I don't know what's causing it. The
Yeah.
problem is none of us care about the headaches.
Yeah. I'm beyond. I've been having headaches my whole life. Like,
Yeah, yeah,
I
like
can handle
nobody cares about the headaches, and the more that you try to explain that, the more they're just, it's like this fight. So,
it. Yeah.
all right. What would you like to say to the doctors who did help you?
I can't even think. I mean, if I'm allowed to name drop, um, Dr. Markle at 2020 Eyeglass saved my life. If it wasn't for him, I would still be trying to figure out what was wrong with me. He, even to this day, he's like, call me and I'll push for you. I'll do anything. And he's an optometrist. He's not a neurologist. And it's always the ones who, aren't in charge of me, like aren't in charge of this diagnosis, that are pushing for me. And then, my chiropractor, Leslie, was the one who pushed for me to get an MRI. And she was like, I'm going to fight for you and I'm going to help you. And now Stephanie Bixby, she's at Health First and she is taking me on. She's like, we are going to get you better, like no matter what. And those are three people that have fought for me, and the only three people, because everybody else, and I've seen dozens, have told me, there's nothing wrong with you. But when those few people who do believe you, it makes the biggest difference because you're not crazy. Like there is something wrong, and it's been a blessing. Like those three have done a lot for me.
I've heard it said that it only takes one person to truly believe in you to make it to where you can change the world. It
Yeah.
only takes confidence of one other person. Um, what do you hope will come from sharing your story along with this project in a whole?
Well, like I said, I want surgeons and neurologists to hear real stories and, not just what they think they know about Chiari, but I want them to see, oh, we might have it wrong. There might be other things to look into. That's my biggest is I hope that they look into other, you know, start getting other symptoms to look into. Like maybe they're missing, like you've said, maybe they're missing something. And I think that's the biggest thing. And I want other people to not feel isolated because I've read dozens and dozens of stories on these pages and it makes you cry because you're like, you feel what they're feeling. And they're like, I don't know what to do. I don't want to be alive anymore. And I can't tell you how many times I felt like that. Like, just take me because I can't take it anymore. So to be able to let somebody else also know that those communities are so helpful, and I'm hoping that this one becomes a huge community where people can get resources and find connections. I mean, that's so important through this.
Yeah, I agree. It's you see, I know with the main group that the majority of us are a part of, it's every day people are begging. They're begging for help. They're like, does anybody know a good doctor or something? Does anybody know anything that'll help? Even if it's just like, diet changes or stuff.
Yeah,
People are looking for more than just medication, you
right.
know, because they've tried so much and they're so desperate that they will try anything. And
Anything.
it is very heartbreaking to see.
And
Um,
it's the same stories, the same symptoms, the same every day. You can get on right now, and there's probably five people who just said the same thing. And
yep,
it's sad.
yep. Um, all right, our last last question and my personal favorite. Is there anything that you would like to say to those who may be struggling and going through similar things? So the people with Chiari malformation and or the associated comorbidities.
You know, every day is hard to fight, but you have to fight because you have to be your own advocate. Nobody's going to help you like you are. And you are not alone because there's, the numbers are rising on how many people are living with this. And you can't give up. You have to find the one in a million doctor that's going to push for you because they're out there, no matter who it is, no matter, like it was my optometrist. Somebody out there is listening, and you just got to keep going. It's really hard, but there's strength in numbers, and I think we're going to have those numbers to help people.
I agree with this. I agree. So, all right, that's all the questions. If there is anything that you would like to add, now is the time.
Um, I think we've covered it. I have all my stuff. I mean, I know I've probably missed stuff, but the majority of it is that's my truth. That's my story. I hope I hope this really changes things. There needs to be so much work done, and I think you're doing a great thing.
I know the whole like with our logo and stuff, doing good things. That's the goal. I want to do good things. And I think as a whole, not because this project is more than just me. It's more than just you. This is way bigger than that.
Mhm.
And the more that this project goes on, it's going to be harder to stop.
Yeah,
So I appreciate you taking the lovely 2 hours to go through this. I know we have our busy lives and everything. So I do appreciate it.
Well, I appreciate what you're doing. That's big. And I think it's going to grow. It's going to go fast.
I hope so. I hope that I get to the point that it's so busy that I'm just losing my mind because I would rather go crazy over that than, the latter, the other. So.